Welcome. You are watching this evening's live stream from the Natural Health Clinic, and we're going to be discussing breast health this evening. I'm your host, Leigh Brunellen, traditional naturopath, whole food expert. I've been practicing now for 15 years in Victoria, Texas here, and also have a second location in Houston as well. So the subject that we're going to be talking about this evening, many women fear it, either for themselves or for their loved ones. And that is, of course, breast cancer and really any type of situation dealing with breast health. What we talk about this evening, we can also help with these particular items as well. So let's get started, shall we? Hopefully these are going to be some of the things that you have not really heard before, unless your physician commonly talks to you about eating cruciferous and brassica types of vegetables in order to improve the health of your breasts. If that has happened, that you may have heard of these things before. But if not, then most likely you have not. So let's first talk about the different couple of the different types of screening for breast health. Of course, you're most commonly aware of mammograms, but there's actually some interesting facts about mammograms that you might find helpful to know, and likely that you're unaware of as well. So, we always hear, especially this time of the month, about mammograms and how important they are, and that they're early detection. Well, the facts show, statistically, that once a breast cancer has shown in a mammogram, even the best ones that are in the market currently, that a woman has actually had the cancer for an average of 6 to 8 years. Already had the cancer for an average of 6 to 8 years. And once she feels a lump, she's actually had the cancer for an average of 10 years. Now, that really doesn't bode very well for mammograms. I'm not saying, don't get one, but certainly if you've already had cancer developing for 6 to 8 years, there's something wrong with the system. And so what is the answer medically? Well, get more mammograms, right? Start at a younger age. And with those types of ideas and actions being used now, the question would be, has the war on breast cancer been won? Or at least, does it seem like we're in the process of winning the war on breast cancer? Well, what do the statistics show? It shows that actually the occurrence rates of breast cancer have increased 290% since 1970. So with everything that's been done, with all the fear that's been promulgated to women, still the occurrence rate has just skyrocketed as far as breast cancer is concerned. So something's wrong. Something about the action plan that's typically given to women is not very helpful. Now, there's other types of breast cancer screenings or that are becoming more popular. One of them is thermography. And as far as thermography, it's interesting to note that if you have a persistent, and it is important to note that persistent, if you have a persistent abnormal thermography screening, then it's actually 10 times a more significant finding than even family history. So it's not just one time. If you have an abnormal thermography one time, that does not apply here. So it's a persistently abnormal thermography screening that is 10 times more significant than even family history. So definitely could be helpful to consider thermography screening. Now, there's different forms of breast cancer, but certainly the most common form that seems to be current is estrogen-based breast cancers. So let's talk about that a little bit. In reality, it's not about having estrogen or taking estrogen. For example, we've heard a lot about hormone replacement therapy or even oral contraceptives, how that can be an increase of breast cancer risk, and that is certainly true. Women, being female, should have naturally higher levels of estrogen, right? So that's perfectly normal for women to have higher levels of estrogen. it's not about having the estrogen in the body. It's actually about the body's ability to remove or metabolize that estrogen. And that's really where the problem is. Many women, and I would go so far as to say even most women, have extreme difficulty in removing, metabolizing estrogen because those pathways are just frankly dysfunctional. So one of the main ways that the body removes and eliminates estrogen is through the liver. All right? Well, how often do you use something or do you eat something that impacts detrimentally the function of your liver? Well, if you use any kind of synthetic creams, any kind of creams, toiletry items that have synthetic chemicals in them, if you do take things like estrogen or some type of hormone replacement or oral contraceptive, if you eat a diet that has processed foods in it, that has sugars in it, that has even grains in it, all those things tend to put more of a demand upon your liver. So when it comes to actually having the ability to metabolize your estrogen well, your body is going to run into some problems. So some of the things that actually can help liver metabolism are cruciferous vegetables such as broccoli and cauliflower and Brussels sprouts. Those types of things. Flax as well can help certain forms of estrogen metabolization. And we're going to be talking about certain estrogen metabolites this evening. 2, 4, and 16, especially the 2 and 16 estrogen metabolites. And there's an interesting study that I want to make you aware of that has to do with using these different types of dietary items, such as the cruciferous vegetables and flax, and how that actually affects estrogen levels. So the study is of 50 females. Of those 50, 27 of the women actually completed the study. Some of them dropped out for various compliance reasons. And 21 of those 27 women had ratios of those 2 and 16 estrogen metabolites that I just mentioned earlier, ratios that were conducive to breast cancer. So everything about hormone land really has to do with ratios between each other and other hormones as well. And so when your ratios are off, that can actually lead to all forms of diseases and situations within the body. And in this case, when there are dysfunctional ratios of 2 and 16 estrogen metabolites, you have a very significant chance of developing breast cancer, for example. So of those 27 who completed the study, moving back to the study, 21 began with abnormal 2-16 estrogen metabolite ratios. And of those 21, 14 were able to shift to a positive 2-16 estrogen metabolite ratio just through those dietary changes of which I mentioned earlier, cruciferous vegetables using flaxseed. So that's pretty significant, pretty powerful testimony as to what diet alone can do as far as prevention of breast cancer. So again, estrogen ratios, 2-16 estrogen metabolites, has everything to do with the prevention of breast cancer. Speaking of prevention, so as I mentioned at the outset, so much emphasis in the medical community is put upon early detection. So let me ask you, if you had a choice, which one would you rather make? Would you rather have early detection or would you rather have risk reduction? So obviously, if you chose, I would assume that you'd want to choose in risk reduction, right? Not really early detection, because early detection using a mammogram means that you've probably already developed the cancer, at least 6 years ago if the mammogram detects it. So risk reduction. And so all the things that we're discussing this evening are going to be concerning reducing risk. You want to change your odds of developing cancer. So moving back to liver, one of the other things is, as far as as liver metabolism, thyroid plays a key role. In fact, hypothyroidism significantly decreases the body's ability to metabolize the estrogen, to move it out of the system. And the reason is that hypothyroidism dramatically impacts liver function. And that's another reason why so many people have issues with congested livers today. So the problem is that even though you may take thyroid hormone, that's a good thing if your labs indicate that and your physician suggests it and prescribes it for you. But that does not mean that your thyroid is now functioning and allowing your liver to metabolize estrogens correctly. All that it means that you're taking this thyroid hormone is you may be feeling a little bit better, your symptoms may be alleviated, but in reality, specifically what it means is that your thyroid hormone within the blood is now within what they would consider a normal range. And that's really all it means. So it doesn't mean that your thyroid is now functioning well. In fact, it probably still isn't. And that's why so many people, not just women, but so many people who take thyroid hormone still have symptoms even though they're taking that hormone. And it certainly means that you're more likely to have issues with your liver metabolism. Another thing that can really promote problems with the 2 and 16 estrogen metabolites are what are called endocrine disruptors. So what are endocrine disruptors? Basically, they are synthetic chemicals that disrupt the doorway into your cells. They're called cell receptors. They can get stuck in the cell. They can impede waste products from being removed from the cell. They can impede proper hormones coming into the cell or proper nutrients coming into the cell. So they just disrupt the entire endocrine system, this glandular system. They are synthetic chemicals. They most commonly appear in cleaning products. Not only what you would use to, for example, clean your bathroom. I'm going to remove this. I think you know who I am now. Don't seem to be removing it. Let's try that. There we are. And all during this discussion, feel free to leave comments in the comment box, and as I can, I will, or questions, I will answer those questions as we go along. I'm going to wet my throat because I seem to have lost my voice suddenly. There we go. You know, I always wondered why comedians, they always had the stage set up so that they have a bench, which they hardly ever sit on, but it's always covered with water. And when I do these presentations, I know exactly why they do that, because your throat tends to start not wanting to work when you speak so much. But anyway, moving back to estrogen disruptors, so they most commonly occur in products that you put on your body. Lotions, makeup, you know, anti-aging products, you know, getting pedicures and manicures when they do the paraffin waxes. Those are extremely horrible for you. They're all synthetic chemicals. They're all endocrine disruptors. They are all potential promoters for cancer. Cleaning products, those can have endocrine disruptors within them, as I mentioned earlier, and laundry products as well, especially dryer sheets. Those have really horrible chemicals that tend to be endocrine disruptors. They mimic estrogen many times. It's what much of those different types of synthetic chemicals do. And so if we're trying to help with ratios of estrogen metabolites, obviously getting chemicals within our body that mimic the very thing that we're trying to make sure we have the proper ratios of could not possibly help our odds of not developing breast cancer. So it is extremely serious, and it is very important that you do take it seriously. One of the things that even medically they are willing to admit is that oral contraceptives and also the injections and the implants and all these things, they can dramatically increase your risks of breast cancer. And if your physician will not admit that, I highly recommend that you get another physician, because they most certainly can. And all this nonsense about oral contraceptives, balancing your hormones, and fixing your acne, and all that garbage is just that. It is garbage. That's really not what is happening. It isn't. When you take an oral contraceptive and it makes your periods feel better or reduces your flow of blood, it doesn't mean it's fixed anything. It just simply means that if I had this light flickering above me and I went and turned the light switch off, and that would stop the flickering, right? The light would be out, flickering would stop, so that means I fixed the light, right? Well, of course not. Likely the bulb needs to be changed. And so that's what an oral contraceptive is. It's merely turning the light switch off so that your female reproductive system isn't flickering and telling you it has a problem anymore. It isn't fixing anything. It's additional amounts of estrogen, which puts more of a demand on your liver to metabolize it and to eliminate it. And it's probably already having a problem with the estrogen that you have, which is why you have an issue with your female reproductive system to begin with. You see that? Now, some of the things also, in addition, that can affect your odds of developing breast cancer are diabetes. So, women with type 2 diabetes, they actually have a 17% increase of developing breast cancer. And the reason is that increased levels of insulin, which of course you have when you have diabetes, increases testosterone, and when you have increased testosterone, you have increased estrogen. And so we're right back at having an issue with the ratios of those estrogen metabolites. So it's very important that if you do have diabetes already, that you work very hard to reverse that particular process, because it not only will have a greater increase of breast cancer, but also things as Alzheimer's and heart disease and renal dysfunction and all types of terrible things that I would assume you want no part of. And how do you do that? Remove your carbohydrates. Nutritional ketosis is one of the very best ways of reversing diabetes. And if you do not currently have diabetes, I would highly encourage you to make sure that you eat in such a way as that you never develop it, which would be the same way as reversing diabetes. Remove your carbohydrates, and again, nutritional ketosis is extremely helpful. One thing in particular that can really create issues, interestingly enough, shown in studies, is the consumption of milk, and I mean cow dairy. So when I say dairy or milk, that's what I'm referring to, the milk from cows. And it's likely because of what's called an insulin growth factor, an IGF-1. They found that an 8-ounce glass for men drink every day increased the insulin growth factor 1 or IGF-1 enough that there was a 4-time increase in prostate cancer with men who would drink cow dairy on a daily basis. And why do I mention prostate cancer? That's not breast cancer, right? But more and more they're finding that the prostate cancers are actually estrogen based. So that goes to show that there is a potential for cow dairy to increase estrogen within the body, and so be very, very careful about your use of cow dairy. All right, I would recommend that you don't drink dairy or don't use dairy. Let's see. That looks like pretty much everything I have there. So, what is the action plan? What can you do? Well, we talked about using flax. Flax actually helps with the 2:16 estrogen ratios. Consume cruciferous vegetables. Again, that's broccoli and cauliflower and Brussels sprouts, etc. And one of the things that was found as well in different studies is that women who had exercised between adolescence and adulthood were much less likely, I think it was over 20% less likely, to develop breast cancer in the future. So why do I tell you that? It's because if you have daughters who are teenage years, encourage them to exercise. It doesn't have to be crazy. They don't have to become a CrossFit fanatic or something like that. But just 3 days a week of exercise for 30 minutes has been shown, especially for women, for girls, adolescents to young adulthood, to significantly alter their odds of developing breast cancer in the future. And of course, the things that you probably already heard before, full-term pregnancies, especially before the age of 30, and breastfeeding for as long as possible also reduces your risk of breast cancers. OPCs, those are extremely powerful antioxidants. Those have been shown to be preventative of breast cancer as well, and other issues with breast health. You can get those OPCs through green tea, and also gut health. So the enteric system has definitely been found to significantly alter your chances of creating breast cancer. If you have good gut health as opposed to bad, your likelihood of developing all forms of cancer significantly diminishes. In fact, they have actually found within the breast there to be a whole ecosystem of bacteria very similar to the gut. So that is also why it's been found in some studies that the use of antibiotics, again, increases your potential for developing breast cancers in the future. And the good thing is that, if you have sinus issues or a cold or whatever the case may be, that there are natural ways of helping with those particular situations. You don't necessarily have to run out and get an antibiotic for that particular problem. You can come in, get tested, and find out what your body could use as support against that type of situation. All right, so let me go to the comments before I talk about one other thing before we conclude. Uh-oh, I was not to my Facebook page. Let me get there. There we are. And let's go over. Sorry about that, guys. Slightly behind in being properly set up this evening. I just have to wait for it to load. Since I'm streaming the broadcast, it takes a minute to load as well. Here we are. Oh, look. No one has asked any questions. Okay, great. So, one of the more unknown potential risk factors for developing breast cancer is actually wearing bras. There is a couple, they actually wrote a book called Dress to Kill. They're epidemiologists. They study different factors leading or causing disease, and they wrote a book, Dress to Kill. And basically they found that the incidences of breast cancer actually increased throughout the decades of women wearing bras more frequently. More commonly, it's specifically underwire bras that tend to create problems, but really any type of brassiere does. And the reason is that it stops lymphatic flow within the breasts. So if you take off your bra and you notice that there are lines either underneath your breasts, around your breasts, or whatever the case may be, that actually is indicative that your bra could be creating a problem because it's tight, very tight. So don't wear underwear. Try to get the bras without underwire, and wear your bra as less frequently as you can, and allow the lymphatic flow to naturally move in and out of the breast. And that will go a long way to helping with your breast health as well. And then something you've probably heard as well is antiperspirant deodorants. They contain certain chemicals, certain toxins that could very likely also be a problem with increasing your chances towards breast cancer as well. So I'd highly recommend looking for alternatives to those things as well. So that's basically it. I hope those particular tips have helped you. And if you have any questions watching in the future, you can put them in the comments box, and as I become notified, I will answer them to the best of my ability. And if you're interested in getting help for breast health or whatever particular problems you may be experiencing, then I welcome you to an initial consultation. And in an initial consultation, it's really designed to see if we can work together as a partnership, as a team, to bring you to your health goals. There are several different forms of testing that we do initially to see where your body's at and what it may need in order to get to where you would like it to be. We also do a report of findings, which is a computerized report that shows you what we found and what we can do to help you. And if we accept you as a patient, then that means that I have every confidence that together we can help you achieve those goals. Now, typically speaking, an initial consultation is $249. Unless you've been referred to us through one of our patients, then we knock off $100 from that, and it's $149. But this evening, if you respond by 11:59 p.m. this evening, and you do an online appointment for an initial consultation, and I'll have all the links below that you can use, then you can get an initial consultation, typically $249, for only $62. So that's a saving of $187. And it's a really great thing that I'm willing to offer to you this evening. So I will supply all those links, and I recommend you take advantage of it. And again, that's until 11:59 p.m. this evening. So hope you enjoyed the information. See you next time. I'm Labor Nella.